We certainly recognize that we are in the midst of a national public health crisis when it comes to the opioid epidemic, and our government continues to work with provinces and territories and all partners on the ground to do all that we can to turn the tide on this national public health crisis. When I hear these statistics today, it's of course very alarming and it's concerning, and that's why that it continues to be a priority file for myself personally and also for my department and the government.
Some very troubling new numbers just out on this country's opioid crisis. According to Statistics Canada, life expectancy stopped increasing in 2017 for the first time in 4 decades due to the staggering number of fatal opioid-related overdoses. In 2017 alone, more than 4,000 overdose deaths were recorded in Canada. More than 1,000 of those involved people in their 30s. Opioids have been a public health emergency in Canada for years now. So what more could or should be done? Petra Schultz is an advocate for drug policy reform with the organization Mums Stop the Harm. She lost her son to an accidental fentanyl overdose in 2014. Ms. Schultz joins us now from Edmonton. Hi there. Thanks for being with us.
Thank you. Thank you very much.
When you hear that news out today from Statistics Canada, that life expectancy in Canada has stagnated, even gone down in 2 provinces, what does that say to you about the state of the opioid crisis in this country?
Well, this news, it's heartbreaking. It makes me angry, but it doesn't surprise me. It tells me that our response is inadequate, considering how enormous this crisis is. We have pockets of innovation in BC and Alberta. Governments have supported and have funded some innovative concepts. But with a crisis like this, we need a population-level public health approach, and we need it from all levels of government in all provinces. And we are not seeing this. And these statistics, they just show that it's not working.
Let me ask you specifically about the federal government. We heard the Minister of Health there in a clip off the top of this segment say that it is a priority file for them. What specific actions do you want to see from the federal government?
What I'd like to see from the federal government is, first of all, a decriminalization of people who use drugs. We should not charge people for personal possessions. People need support, they need harm reduction, they need access to treatment, they don't need to be in jail. The second thing we are asking for is a safe supply of opioids or generally of substances for people who need them, who struggle with problematic use. Because what people are dying from right now is a toxic, illicit street supply. People are no longer dying from prescription drugs, but there are substances available. The government has moved to make them available in Canada. Heroin on prescription, for example, there are other substances that can be substituted for that. And we need to make those available widely throughout the country for people who struggle with addiction.
How do you surmount, or what do you recommend, or what is your advice on surmounting the challenge that might be posed by the fact that decriminalization for people who are not familiar with the opioid crisis, pardon me, would be sort of a scary thing?
Well, we don't, for people who use problematically, it's a symptom of the health condition they're struggling with. And in other health conditions, we don't penalize people for needing support and needing medical care in some cases. So we just have to explain to people that it's not a criminal matter we are dealing with, and that people need our support and need our understanding. It is really something that we by sharing, that is one thing we do by sharing our stories, just explaining to people that everybody in Canada is affected and could be affected by this. And nobody is isolated. And if you think it's not your problem today, it could be your problem tomorrow if it's your family member.
The political will to go the decriminalization route doesn't seem to be there at this point. I remember covering not so long ago that Liberals themselves in their convention wanted it. There was a motion put forward, but the health minister will not go that far. What do you think will be necessary to change that political will for people who want to see it changed?
I think moving forward, we will see more discussion around this. There are groups in Canada, such as ourselves, the Canadian Drug Policy Coalition, other organizations, who are talking about what such a model could look like. I've just come back from an international conference in Portugal, who have learned more about what they are doing, what is working, what is not working. And we will continue to propose this model, explain it to people, and see how it could look like in Canada. But meanwhile, what the government can readily do is is provide safe supply. And we have some models of safe supply that they have helped introduce and fund, including in BC and Alberta. There are programs where people can get their substances on prescription, and we just need to expand that more widely and make it available throughout the country to people who need them.
The two provinces that you mentioned have been particularly hard hit, even as these statistics bear out. Do you think, though, that will continue to be the case, or that, I mean, we've seen Ontario, for example, recently join a lawsuit on opioids with BC. Do you think it'll be more widespread, not as sort of endemic to those two provinces?
We've seen the pattern with fentanyl. It's moving. It is a very lucrative substance to sell. It's easy to smuggle. It's hard to keep out. And it started in BC. It's moving into Alberta. It's moving into Ontario. It'll be in the rest of the country. We've seen patterns in Europe where they're having problems in the United Kingdom. It's slowly moving into other parts of Europe. It's just a matter of time. So what I would suggest is that we are prepared and we act on this crisis before it becomes a problem. When our son died in 2015, I never imagined how many more would follow him. And so many more have followed him because we've watched this happen and we haven't taken the actions that are needed.
All right, I'll leave it there. Thank you very much, Ms. Schultz. Really appreciate your time today. That's Petra Schultz of Mums Stop the Harm in Edmonton.
Yeah, thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video. Thanks for watching.